You're listening to the Quint's podcast.
Just 3 months after it rolled out its first phase of COVID-19 vaccinations, India hit another grim milestone on 7th April as it registered over 1,15,000 fresh cases of COVID-19. However, several states are reportedly staring at another point of concern, a COVID-19 vaccine shortage. At least 6 states, namely Andhra Pradesh, Chhattisgarh, Haryana, Odisha, Telangana, and Maharashtra, have reported shortages of Covidshield vaccine, which is one of the 2 COVID vaccines approved by the Ministry of Health. The hardest hit state, Maharashtra, has vaccine stocks only for 3 days, according to the State Health Minister Rajesh Tope. The reported shortage of vaccines has also resulted in COVID hotspots such as Pune to shut over 100 vaccination centers. Mr. Tope further stated that he has requested the center for additional vaccines. But the center has hit back on Maharashtra's SOS on vaccines. In an interview with NDTV on 7th April, Union Health Minister Dr. Harshvardhan slammed what he called a quote-unquote deplorable attempts by some state governments to distract attention from their failures and spread panic among the people, and that there are no vaccine shortages in India. Now, there are obvious contradictory statements when it comes to vaccine shortages in India. So, to get a sense of what the ground reality is in the states reporting these vaccine shortages, especially in hotspots like Pune, I spoke with Dr. Varsha Dange, who is the medical officer for the Pimpri-Chinchwad district of Maharashtra. According to her, the district today has now officially run out of Covidshield vaccines. To gain a larger picture of where we are headed, you'll also hear from Dr. Subhash Salunke, who is the COVID-19 technical advisor for the Maharashtra government. You're tuned in to The Big Story, the podcast where we dissect the headline-making news for you, and I'm your host, Himmat. There have been several media reports over the past week reporting on vaccine shortages in several states. So let's first get a status of these states. According to a report by the Economic Times, vaccine stocks in Andhra Pradesh will run out today. In Telangana, the Health Ministry has stated that its vaccine stock will be sufficient only for the next 3 days. It further stated that it has the capacity to vaccinate 1 lakh people daily, but its inoculations right now are only 60 to 70,000 due to supply shortages. According to a report by the Print, Chhattisgarh ran out of stocks on 5th April. However, it has now received a fresh batch of 3,25,000 doses. The State Health Minister T.S. Singh Deo stated that the state's inoculation rate subsided due to the supply shortage. And speaking of Chhattisgarh, Union Health Minister Dr. Harshvardhan did not hold back his comments regarding the state's vaccination program. In his interview with NDTV on 7th April, the Health Minister attacked the Chhattisgarh Congress government, saying it has refused to use Covaxin and by its actions, it has, quote-unquote, had the dubious distinction of being perhaps the only government in the world to have incited vaccine hesitancy. Now, moving to Ghaziabad in Uttar Pradesh, the Quint spoke to 12 private hospitals in the city who stated that they have run out of vaccines since the supplies from the district's chief medical officer have dried up. The Quint's reporter Anthony Rosario spoke with several hospitals, including St. Joseph's Hospital, which ran out of vaccines on 3rd April, and this reality is spread across hospitals in the city. Eligible vaccine beneficiaries are now staring at closed hospital entrance doors, which have notices posted stating COVID-19 vaccine not available in stock. If you want to read more on vaccine shortages in Ghaziabad, a link to Anthony's report is in our show notes. Now, moving to the worst hit state by the pandemic, and the first one to signal flares on vaccine shortages, Maharashtra. Maharashtra has been reporting the highest number of daily cases in the country. On Wednesday, it logged 59,907 new cases and 322 deaths in 24 hours. Earlier on 7th April, Maharashtra Health Minister Rajesh Tope stated that every week the state requires 40 lakh doses to vaccinate 5 lakh people a day. But according to him, the state currently has only 14 lakh doses left and is a mere 3 days away from completely drying out. Pune, which is a major hotspot for COVID, has shut down 109 vaccination centers due to vaccine shortage, according to a tweet by NCP MP Supriya Sule. But the Union Health Minister has denied any vaccine shortages in the state and has called out the state government's, and I quote, lackadaisical attitude which has brought down the entire country's effort to fight the vaccine. So, what is the reality in Maharashtra? To get a sense, I spoke with Dr. Varsha Dange, who is the medical officer for the Pimpri-Chinchwad Municipal Corporation. Here is my conversation with Dr. Dange on vaccine supply and the state of vaccination shortages in the district.
Ma'am, the last time we spoke, which was around exactly 3 weeks ago, actually, when we did an episode on the rise in cases in Pune, when Pune was facing a spike.
Yes,
And at that time,
yes,
you mentioned that the vaccine supply was about 10 days. So you get vaccines for
yeah,
10 days, and then it is revisited, that the amount of cases is analyzed, and then it's revisited, and accordingly, the district gets its vaccine dosages right now. So what is the ground
yes.
reality right now as such?
See, as far as till yesterday, we not till yesterday, like till last week, we received as per the consumption of the average consumption which was there in the last 10 days. So we had received the doses, but then unfortunately today in Pimpri-Chinchwad Municipal Corporation area, the vaccine, Covishield vaccine, that will be over by the end of the day, and we have a certain amount of co-vaccine which is there with us, but then the state government has issued guidelines to use this co-vaccine or these
Mhm.
co-vaccine doses for the second dose candidates or the second dose beneficiaries, which we had started at around like 13th to 15th of March in Pimpri-Chinchwad Municipal Corporation area. So like those around about 12,000 people we had vaccinated with the co-vaccine, and now we have received another 12,000 doses which are there with us. We will be utilizing them once for all the second doses of these co-vaccine beneficiaries,
Yeah.
which will start around after say 10th of April or maybe 13th of April.
Okay. Supriya Sule also yesterday just said that 100 vaccination centers in Pune are being shut because of vaccine shortage. Are vaccination also being temporarily halted in PCMC?
Yes, in PCMC, like today we were running in full, all 100% centers were open for today. But then tomorrow we will take the stock of the situation by end
Mhm.
of the day. By 5 p.m. the reporting would be there. And thereafter, if at all some vaccine is left, then we would be able to open up few centers, like very few centers tomorrow, but
Mm.
otherwise in maximum centers we will have to keep shut because there is no Covishield with us. We
Yeah.
had received more than 2 lakh doses of Covishield and like around about 30,000 doses of vaccine,
Mhm.
amongst which we have actually vaccinated more than say 2 lakh people
Mhm.
with Covishield, and Covaxin it is all around 12,000. Right now we are having Covaxin with us, which is being kept only for the second dose beneficiaries.
Okay.
So practically, we won't be able to open up all the centers tomorrow or very few centers tomorrow for vaccination.
Yeah, so the situation is quite dire when it comes to it's at the last remains right now, especially for Covidshield. So, how much stock in numbers is left for Covidshield, if you can say? You said it's only available till the end of the day.
Covaxin, it is, with us, Covaxin is enough in numbers to vaccinate all the first dose people or the first dose beneficiaries. So no issues or no worries about the Covaxin beneficiaries who had received the first dose. But for the Covishield,
Mhm.
as far as right now, currently we don't have any vaccine
Yeah.
in the central vaccine store of PCMC, and
Uh-huh.
we have actually demanded over 1.5 lakh doses to
Mhm.
state government and deputy director Pune circle office. So
Mhm.
let's see when we receive the doses. Once we receive, immediately we can open up all the centers.
Have they given you a timeline of when you'll be able to receive these vaccines as well for Covidshield?
Not immediately. We won't be getting it by tomorrow, that's for sure.
Yeah,
Maybe in couple of days or couple of days or the next week.
next week as such.
So today is 7th, yeah. So maybe couple of days also we may get the vaccine, or maybe in the next week we will get. It's not very clear with us right now.
But the larger question is, where are we heading in this second wave of the pandemic? Are we nearing an end to it, or is the worst yet to come? Dr. Subhash Salunke, who is the technical advisor for COVID-19 for the Maharashtra government, weighs in on where we are on the COVID graph.
Well, at this juncture, as on today, as anticipated, we are on the rising arm of the curve. That means we are getting more cases day by day, and it will continue for next at least couple of weeks, because see, today in Mumbai, say 8,000-9,000, or Pune 7,000-8,000 people are coming to the notice after carrying out the test as a new cases. Now these new cases or incidents जिसे बोलते हैं. Now when you see one positive case, there are at least 25 times the number of cases who are positive but who are not detected. That means in Pune, if there are 8,000 people being reported, multiply it by 25 times, that comes to 2 lakh. So 200,000 people in Pune are right now likely to be positive. Now same applies for every city, not only in Maharashtra, but even outside. The fact remains, these are the people who are potential transmitters, some of them, not everyone. Some of them are super transmitters or super spreaders, and they transmit more. Now in last few days, which was not seen in the first wave, families are getting infected. One person in the family, he infects everyone, he or she infects everyone. So that is happening because of the occurrence of changes in the virus itself. Now the virus being a dynamic entity, it is not a dead thing. It goes on multiplying. And when for last 1 year, this virus, COVID or coronavirus 2, is getting now circulating in the India, it passes from one individual to another individual. And when it passes from these individuals, it undergoes changes. We call that as a mutation. Now that mutation is occurring, and that mutation is empowering this virus to sustain itself and increase its capacity to transmit or infect number of people more and more. So this is what is happening. And because of changes occurring in the virus, because people are behaving irresponsibly, at least they behaved irresponsibly in last couple of months, and that is why they get infected and they are infecting others. So host, that is human beings, agent, that is virus, and environment. All these three things put together are playing havoc right now, not only in Maharashtra, but many states in the country. And this is likely to continue because those who are infected and those who are not coming out as a clinical case will eventually come out through after their incubation period is over. It could be 2 days, 4 days, 6 days, 14 days, who knows. That means you please note that next 2 to 3 weeks, we are going to see upward trend of these cases unless we intervene. If we don't do anything, this trend will go up and it will remain for a pretty long time. So intervention is obligatory because otherwise there will be no place for people to be treated and there will be no beds in the hospital because there is a limit. There is a fine, it's not infinite. Number of beds available in both public and private sector hospitals is limited. Now, under the circumstances, we are at a very critical juncture. We don't intervene, we land in serious trouble. We have already landed in trouble and it will be a great disaster.
With several states now issuing night curfew and even weekend lockdowns, after a year of battling COVID-19, are lockdowns the only solution to curbing the cases? Dr. Salunke weighs in.
Yes, it is possible. However, it is not possible that there will be no restrictions. Lockdown is the highest limit of the restrictive, mechanisms. But we could have the mechanism by which restrictions are there, people accept those restrictions, and it is not because the policeman is standing outside and so I'm going to follow. But on my own, if we follow those basic principles of COVID appropriate behavior and also cooperate with the government, definitely instead of going for total lockdown, the attempt that is being made right now in Pune, and I really appreciate the leadership of Pune district, both guardian minister, all the MPs, MLAs, municipal corporation and everyone, that they ultimately agreed with the suggestions of people like us who have public health experience and expertise. And that's how the mechanism accepted in Pune city is restrictions, ensuring that the people who unnecessarily create problem for others are being punished, and there will be definite actions or strong actions against unnecessarily gathering, where there is a possibility of transmission are reduced. All these things put together have now come to as a part of practical implementable strategies as shown in Pune city as adopted or as accepted by the, you can say the decision makers of Pune city.
As Dr. Salunke said, we are going to continue seeing a spike in cases over the next 2 to 3 weeks. So mask up when you step out, maintain physical distancing, and continue washing your hands. If you want to know more about COVID-19, vaccinations, and treatment, head over to the Quint Fit and the Quint websites. If you liked listening to this episode, please subscribe to The Big Story for episodic updates. We're available on Apple, Google Podcasts, Spotify, JioSaavn, and most of the other popular podcast streaming platforms. For other podcasts, please log on to the Quint website, and for any feedback, please shoot an email to podcast@thequint.com.
Thanks for listening. Log on to the Quint's website and check out our other podcasts.